Monday night.
And you're staying in a hotel?
I did just yesterday, yes.
You've given a number of media interviews regarding this case, correct?
Say that again, please.
You've given a number of media interviews regarding this case, correct?
I have given 2.
Were you still being treated as a patient by Conrad Murray in 2009, or was your relationship social and as friends?
In 2009, I tell you, I cannot remember, but definitely friends. I can't remember the last time Dr. Conrad seen me professionally.
Can you give us a year, approximate year, that he saw you professionally?
It was 2008, 2009, but I would say 2008.
So when was it that Conrad Murray informed you that he was going to be leaving his practice and being the personal physician for Michael Jackson?
It was right before he left us to go to Michael Jackson.
Can you give us a month?
I cannot.
Could it have been around April 2009?
Could have been.
And you're not just a friend of Conrad Murray. You actually described him in your statement to the defense counsel as your best friend, right?
He's my best friend.
You email him via personal email accounts, correct?
No, I do not email him.
I think you said you have all his phone numbers and you talk to him on his personal cell phone?
Yes.
Now, when you were first treated by Conrad Murray, this was for a heart condition?
Yes.
Okay. Had nothing to do with a sleep disorder, correct?
No.
Had nothing to do with any...
Double negative.
Is it true that it had nothing to do with a sleep disorder?
Yes, it is true. Yeah.
And is it true it had nothing to do with any type of drug dependency issue?
No.
And when you first met him, that was in a hospital,
I'm sorry,
correct?
you want something cleared up?
Yes, sir. I would like him to repeat the last question, please.
I'll ask the court reporter. The question was, did it have anything to do with a sleep disorder?
No.
Drug dependency?
No.
I think that was the last, wasn't it?
Thank you, yes.
Okay, thank you.
And when you first met him, you had a heart condition. This was in a hospital, correct?
Yes.
And before going into the procedure, Dr. Murray explained to you what was going to happen,
Yes.
and he had you sign some paperwork.
The hospital did.
You signed some paperwork.
Yes.
And this was about 11 years ago, correct?
Yes.
During the procedure, you looked up and you could see the monitors in the room. You indicated you looked up and saw that, correct?
I asked to watch it. Yes.
Yeah. And you said you looked up and you could see the screen showing what your heart was doing, correct?
Yes.
Okay. Had lines on it and showing the rhythm of your heart and your oxygen saturation, things of that nature, correct?
Yes.
How many other people were in the room other than Conrad Murray?
I think 3.
3 additional people?
Yes.
Okay. So 4 people in a hospital room with the monitors doing this procedure, correct?
Correct. Yes.
And all of your, I guess that was the initial single stent. Is that accurate?
Yes.
And then I may have misheard. Were there additional stents put in?
Yes.
Okay. And those were all done in a similar circumstance in a hospital with the equipment and personnel, correct?
Yes.
And it all related to a heart condition.
Yes.
You want to clarify something?
I would like to clarify
Mr.
something.
Walker?
Please.
My heart is good, okay? I have a good, strong heart. I have real bad veins and arteries from cholesterol.
Okay.
So
But-
that created the heart attack.
Okay, but everything Dr. Murray did for you related to putting stents so your heart would function properly.
Yes.
Okay. Thank you, sir.
Mr. Walgren, thank you. Ms. Chernoff, redirect exam.
Mr. Causey, the media interviews you did, were you paid for those?
No,
Why did you do them?
to help my friend.
Well, why did he need that?
To help my friend.
Why did he need that help? What was the problem?
Excuse me. I didn't-
Why did he need that help, Mr. Causey? What was the problem?
Objection, relevance, Your Honor.
I'm going to sustain the objection.
Mr. Causey, had you been seeing the press prior to doing your interviews? Had you been seeing the press reports about Dr. Murray?
Objection, relevance, Your Honor.
Just a moment. You can ask, I'm going to sustain the objection, can ask the witness to explain the basis for his giving any interview. You can rephrase.
Thank you, Judge.
Thank you.
Can you explain the basis for your decision of why you decided to give these interviews?
Objection, Your Honor. It's been asked and answered. He said to help his friend.
Overruled. You may respond if you like.
The reason I decided to help, or to come and help Dr. Murray if I can, is I've known him, I know his love, compassion, his feelings for his patients. You can ask every one of them, and they will say exactly the same thing. He's the best doctor I've ever been to because of the treatment, because of the clarity of what he's doing, and the follow-ups. And I just don't think he did what he's being accused of, and I wanted to help.
Okay, I have no other questions.
Thank you, Mr. Chernoff. Recross, Mr. Walgren?
Yes, please, sir.
Thank you.
There's nothing in the world or any piece of evidence that would cause you to change your mind about Conrad Murray, correct?
I'm not going to say nothing will, but
Well, you don't.
what I know right now and what I feel, he didn't do it.
And if you assumed, I want you to assume, okay? I want you to assume that Conrad Murray acted with gross negligence in this case and caused the death of Michael Jackson, okay? You would still be here giving this testimony to the jury, correct? For your best friend?
I would be here, yes.
Thank you.
Walgren, thank you. Mr. Chernoff, redirect? No, Judge. Thank you. May Mr. Causey be excused, Mr. Chernoff?
Yes, of course.
Mr. Walgren?
Yes, thank you, Your Honor.
Thank you. Mr. Causey, I want to thank you for your testimony, sir. Please don't discuss your testimony or the facts of the case with any other witness until we finish the trial, and you may step down and leave, sir.
Thank you very much.
Thank you. Mr. Chernoff?
Andrew Guest, please. Andrew Guest.
No, it's not necessary. Thank you. And may I see counsel for just a moment, please? Thank you.